Okay, so I am Megan Craig. I'm a PGY4 and the chief resident for the University of Central Florida program partnership with HCA Florida West, located in Pensacola, Florida. So a little bit about our program. We are a part of the UCF and HCA consortium, which involves all these hospitals listed here kind of across the North Florida region. And they have 43 residency and fellowship programs with over 700 trainees across the state of Florida. We're a 3-year advanced program, and now our hospital has a TY program as well. So we love to have our residents just do the TY here, and then you get to spend all 4 years here. We do take 6 residents per year. We're unopposed. And for the most part, you're one-on-one with your attendings, with the exception of sometimes 2 residents per attending. But no one's competing with you for procedures on like your outpatient rotations, which is nice. HCA Florida West Hospital is 515 beds. We're an advanced primary care or primary stroke center and a level 2 trauma center. And then our rehab is currently undergoing renovation, so we're getting revamped. We are still connected to the hospital, which is nice when you have transfers. We have 58 beds, and then back in 2023, we served just under 1,000 patients, with about a third of them being stroke and TBI, a third being orthopedic, major multiple traumas and amputations, and then the other third was kind of divided out between debility, cardiac, pulmonary, spinal cord injury, and then other neurological conditions like GBS or Parkinson's. This is some of our core faculty. So Dr. Belcher is our program director. She's pain medicine trained. She does our outpatient pain medicine and musculoskeletal rotations. Dr. Burton is the associate program director, and he is one of the inpatient attendings. Dr. Buckhalter is also very heavily involved in our program from an education standpoint. He is not currently practicing clinical medicine, but is starting to get back into it. He is pain medicine trained as well. Dr. Terry is also pain medicine trained, but she no longer does pain medicine and is currently running our consult service. Dr. Slobodian is another inpatient attending, and he is spinal cord injury boarded. And then Dr. Hulk is over at Nemours Pediatrics, and she does pediatric rehab. So some of our training sites, so of course at West Florida Rehab and then the hospital. We also go to Andrews Institute, which is over in Gulf Breeze, which is about 30 minutes from the hospital. Hanger Clinic for prosthetics and orthotics. Clearway Pain Solutions for our musculoskeletal and pain rotations. Nemours Pediatrics. Emerald Coast Neurology and Bolin Neurology. So at Emerald Coast, we do our EMGs and then sometimes see some of their consult patients or like their new patients, and then also some exposure to Botox injections there. And then Bolin Neurology, we just added in working with her. She is movement disorders trained and also does a lot of toxin injections over there. And then Dr. Brown at Brown Rheumatology for a rheumatology rotation. So this is kind of what our rotation schedule looks like this year. I will add in a little like asterisk caveat that this is probably going to change in the future, as this is the PGY2 class now is our first class with 6 residents. So as they kind of move through their years and we get more classes of 6 residents, then the schedule might change and shift a little bit. But for now, you do 6 months of inpatient during your PGY2 year, and then 3 months during your PGY3 and PGY4 year to give you your 12 total months that you need throughout residency. You do consults during PGY2 year, MSK rotation, a spine rotation with Dr. Metzger, who's an orthopedic spine surgeon, inpatient neurology, movement disorders, and pediatric rehab. And then PGY 3-year, you do 2 months of consults at MSK rotation again with Dr. Belcher, another separate pain medicine rotation with Dr. Walsh, who does more of the minimally invasive procedures and kind of higher level pain medicine procedures. A month of EMG, month of movement disorders, peds rehab, and then you get 2 electives during your PGY 3-year. And then moving into PGY 4-year, again, another month of MSK, month of EMG, or actually, that should be 2 months of EMG, a month of rheumatology, month of sports medicine, prosthetics, orthotics, peds rehab, and then 1 elective during PGY 4-year. And we kind of set up the elective schedule this way so that if you're interested in pain medicine, and you have to apply during your PGY 3-year, you can set up some electives at away electives during that time to expose yourself to different programs or different attendings for more pain medicine exposure. And then these are some of our electives, and they're also, some of them are required rotations, but you have the option to repeat them again as an elective if you wish, and we're always adding in more electives, or if you have an idea for a new elective, you can always bring that and then kind of go through the process of getting it approved. So we have couple pain medicine rotations. One is with South Lake Pain Institute in Claremont, Florida. One is with Ortho Alabama up in Birmingham. You can do a brain injury rotation over at Brooks Rehab in Jacksonville, rotate with the PM&R group out of Tampa, and then kind of do another month in rheumatology, sports med, ortho spine, neurology, movement disorders. And then this OCC is kind of a grab bag of different things. That's the one that we're starting with Dr. Buckhalter and working at it's called Hope and Health Clinic, which is a clinic where patients that are maybe don't have insurance or not a lot of funding can go and still get seen and get joint injections and things like that. And then that includes, Dr. Buckholder does a lot of medical legal stuff. So you might see some IMEs and kind of get exposure to that side of things. Here are some of our fellowships. So we just graduated our first class in 2024. So we've had 2 graduating classes, and 4 of those residents have gone on to fellowship. So we've matched sports and spine at OSS Health in York, Pennsylvania, TBI at Miami, a hospice and palliative care over at UC Davis in California, and then a sports medicine at Andrews Institute. And then my class, I'm applying TBI, and then we have 2 residents applying pain medicine this year. Our call schedule. So residents mostly take call during their inpatient rehab rotations. And we do home call. In addition to some of your inpatient rehab rotations, PGY 3s can take call during their consult months. And then there's 1 other month that you might get picked to take call on. So yeah, we do home call. As a PGY 2, you're only on call until 8 p.m. for your patients and doing medrex. You don't take overnight call. That falls onto the PGY 3s and 4s. So it comes out to about 1 week a month. So we split it up Monday through Thursday and then Friday to Sunday. So you cover 1 Monday to Thursday during the month and 1 weekend during the month. And then also PGY 2s will come in on the weekends if Dr. Slobodian or Dr. Burton is working, depending on who they're working with at the time. So that's about 1 weekend a month. And then the 3s and 4s, yeah, work the weekend that they're assigned to night call. Our didactics, mostly attending led with some resident led lectures. So residents will lead lectures involving case reports, journal clubs, and then we'll give 1 like rehab based lecture each year. And then we started adding in other lectures with pharmacy and our psychiatry residents. Our didactics we'll get talks and reps to come in, other guest lectures. We like to do a lot of career development and finance lectures as well. We do a trauma series every other year with Dr. Slobodian, get a good bit of exposure to the medical legal side of medicine, and getting how you can get involved in that in your future practice. We do physical exam curriculum and an ultrasound curriculum with Dr. Terry. And then we also have Dr. Bradham on our faculty, and he gives us lectures as well. And then, like I said, we do interdisciplinary didactics with the pharmacy residents, and then so there's one with just pharmacy, and then a separate one with the pharmacy and psychiatry residents, which just started this year with the psych residents. You take the SAE every year, and then PGY3s will also take the EMG SAE. We have what we call CIS training, so it's like spinal interventional something training, where you go in with Dr. Buckhalter once a week using a mannequin model with the fluoro, and learning all the different spine procedures on a, it's not really a cadaver, but like the mannequin before you're expected to do it on a patient. And then grand rounds, journal clubs, and then we get tested about quarterly on our different didactic topics to make sure that we're retaining some information from them. Other perks that we have a dedicated office space in the rehab, which just got recently redone. And then the chief resident has an office up in GME, which is in the main hospital space, but typically whoever's on consults just uses that office as a place to work. Additionally, even though we are partnered with HCA, you are employed through UCF. So this means that you are, these years, if you're interested in doing PSLF, do count towards that. You get access to the UCF College of Medicine library, which has lots of textbooks and their research database, but then you can also access the HCA database for research as well. So you kind of get perks of both places, which is nice. You get an AA PM&R membership in Q Bank, AAP membership in Question Bank. They'll buy you Bradham's textbook and a 3-year subscription to PM&R Recap. And then also we get AA&EM as well, which has a lot of great EMG training and lectures. And then this year we added in another like Asia course for spinal cord injury learning. Other things, the cost of living in Pensacola is about 5% lower than the national average. And they try to keep our salaries fairly well compensated. They look at the average, the like median salaries in each area, and the way UCF and HCA does it is kind of based off location rather than having one salary to fit all the different areas, since Orlando is a little bit more expensive to live in and they have a bunch of toll roads, so they compensate them slightly more than we do here in Pensacola. But overall, we're pretty well compensated, I'd say, compared to the median salaries in Pensacola. You do get a laptop and work phone that's provided for you. And then we also do some sports coverage with the Pensacola Ice Flyers, which is a minor league hockey team, and the University of West Florida, with Dr. Hackle from Andrews Institute. Our time off, we get 20 PTO days, 10 sick days, which you can roll over 5 of those each year, and then 3 conference days. Ooh. So other wellness things and good perks to have is we do get free food in the cafeteria, and then there's also Chick-fil-A available in the hospital to buy, Subway, a smoothie acai bowl place, and then Drowsy Poet, which is a little coffee shop. We also get free parking, which is nice. My intern year did not have free parking, and it was like $600. So having free parking is a good perk that you might overlook in your search for a good program. We also get catered meals when we have grand rounds. A lot of times it's Chick-fil-A, but they like to mix it up sometimes. And then some electives, like when we're on EMG over at Emerald Coast, they get drug rep lunches every day. So it's a good free meal to have as well. Our work hours are pretty decent. Mostly inpatient consults is when you're working a little bit more, but otherwise it's a typical clinic hours work week, and you rarely go over 50 hours a week. We do roundtables with Dr. Belcher quarterly to kind of discuss any issues you might be having or that come up. And then as chief resident, I like to do a roundtable with the residents a little bit more frequently to check in and see how they're doing. A lot of good peer support here. A lot of mentorship. So as a PGY3 resident, you'll get paired with an incoming PGY2 resident to kind of help with transitioning and act as a mentor for them. And then you get paired up with an attending mentor as well. And then we do quarterly resident wellness events. So we've gone bowling. Dr. Buckhalter likes to go to IMAX movies and dinner. We've done axe throwing. We did go-karting. And I know they've done like putt-putt before I got here. So lots of little activities that they like to do for us. And then just a little bit more about Pensacola. So we are the furthest west in the panhandle of Florida. They also like to call us Lower Alabama, which does feel like that at times. I know my house is like 5 miles from the Alabama line. We have great beaches. It's like one of the top beaches in the country, with like the white, soft, powdery sand and clear blue water. We're home of the Blue Angels, so they'll do practice on Tuesdays that you can like take a little ferry out and watch them practice. And then they have their big show here in July as well. That's like a national holiday of Pensacola is a Blue Angels show and Blue Angels weekend. And then they'll do also a Blue Angels homecoming at the end of their show season in November. That's down at the Navy base. Pensacola was founded in 1559, so we're one of America's oldest European settlements. And if you've ever been to St. Augustine, they'll say that they're the oldest, but from what I've heard, St. Augustine is the longest contiguous settlement, but Pensacola was the first. We have a lot of new restaurants and breweries that pop up. There's a weekly farmers market downtown, gallery night, which is similar-ish to a farmer's market that happens once a month on the third Friday of every month. Lots of festivals throughout the year. We're about 3 hours from New Orleans. So that's always fun to do for a weekend trip. And then we have the Ice Flyers, like I mentioned earlier, and then the Blue Wahoos is the minor league team here. Here's just some pictures of residents. So we this is the UWF school, but FSU has a med school here. So we go and give a gait talk to them and kind of demonstrate different DME. We do a hands-on EMG lab where we get to shock and poke each other. We all run, there's a big race each year that a bunch of us sign up for and run it. And then we have an annual Christmas party. And then this is like one of our OTs demonstrating one of their modalities here. Just some more pictures of us at the AAP conference. This is when Dr. Bradams came to give an in-person grand rounds lecture. The residents like to get together and play pickleball. And then with Dr. Buckhalter, he does this thing for a local news station called Ask the Doctor. So residents can go on and talk about whatever topic is of his choosing that month. So here's our contact information. So our program coordinator is Cindy, and then this is my email as well. And then you can follow our Instagram. So if you guys have any questions kind of as you're applying and throughout the process, don't hesitate to reach out. I think we have a couple of minutes left for questions.
Yeah, that was perfect.
All right, well, I'm gonna stop sharing. So if you guys have any questions or anything, again, just email me or you can message us on our Instagram page. Thanks.
Looks like there's one in the chat saying,
Sorry.
do you feel residents get enough exposure to sports if that's something they're interested in?
Yeah, definitely. So Andrews Institute is pretty big in the sports world with Dr. Andrews opening it. He doesn't practice anymore. He's now retired, but Andrews does weekly didactics on Monday nights that you can go to if you wish. Not mandatory, but it's great exposure to that and kind of getting connected into Andrews Institute and their fellows and attendings there. And then Dr. Hackle, that we rotate with him at least twice during residency, and if you're interested, then he's a good connection to have, and you can do sports coverage with him at UWF for football and different sports there. And then you can sign up for the Pensacola Ice Flyers game for sports coverage as well.
Sorry, I had a quick question if that's okay.
Yeah, go ahead.
From your presentation, it seemed like there's quite a bit of emphasis on pain management, injections, guided injections, that sort of thing. Do you guys get to do many, epidurals, SI injections, anything like that under fluoroscopy, or is it mostly ultrasound?
We get really good exposure to spine injections. They don't let us do too much epidurals. I mean, you get to practice them in cysts, but I haven't done any on a real patient, but like I've done caudal epidurals, dorsal
Mostly
medial
lumbar, not cervical.
sorry, what was that?
Mostly lumbar, not cervical.
Yeah, but I know with like the Claremont rotation with Dr. Paez, I think that he lets you do cervical there. And then we're also getting a new pain doctor. I'm actually like going to shadow him tomorrow morning. So I'm not sure if he will let us do cervical. It's kind of just what your attending is comfortable with. But in the CIS training, then you can learn cervical there. It's just what the attending is comfortable with of doing cervical on an actual patient. But you get plenty of like SI joints and caudals and dorsal medial branch blocks. And we do some like
Thank you,
cluneal
Dr. Craig. Appreciate
nerves
the time.
and stuff like that.
All right. Well, thanks, Dr. Cray, for presenting.